Relational, emotional intelligence starts with brain health. If you get the brain right, your mind will follow, right? So we're talking about raising brain healthy children. How much screen time, how much sleep, how much fiber, how many omega 3s, like having all those conversations, all those things impact how you feel, how you show up, how you focus on any given day.
Welcome to the Shaping Freedom podcast, where we dive into conversations that inspire personal growth, transformation, and clarity in challenging times. I'm your host, Lisane Basquiat. Today's guest is someone who is bringing liberation to the mental health space through both science and spirit. Dr. Napatia Gettings is a double board certified psychiatrist, speaker, and founder of the Brain-Based Holistic Health Institute. She's known for her groundbreaking work integrating brain imaging, trauma recovery, and executive function coaching into a holistic psychiatric model that treats the whole person, not just the diagnoses. Her training with Dr. Daniel Amen and the Amen Clinics sharpened her focus on what's happening beneath the surface, how things like inflammation, undiagnosed trauma, and brain chemistry contribute to behaviors we've long misunderstood or misjudged. She's a fierce advocate for mental wellness in youth, professionals, and communities of color, and she's using her voice to disrupt outdated ideas about what it means to be healthy, resilient, and well. This is a conversation about more than mental health. It's about reclaiming sovereignty over your mind, healing generational patterns at the neurological level, and choosing to shape a future rooted in clarity, dignity, and self-respect. Welcome to the podcast, Napatia.
Thank you. Thank you so much for that wonderful introduction. I think you captured just about every passion.
I think there's more, though. I think there's more. I think that I'm really looking forward to hearing even more. That was just what I could gather.
Thank you.
First of all, just before we even get started, so you and I met very recently at an event, and we started chitty-chatting about, I don't even know how we got onto the topic of brain health, but when we did, the passion and how deeply connected to the work that you're doing radiated from you, Napatia. I was just so impressed and so touched by how excited you were to share this knowledge that you have and this work and experience that you've been building. And so I knew at that time, for many reasons, and that was the thing that led me to right there, like we were at an event with hundreds of people. And in the middle of all of it, I was like, girl, would you come on my podcast?
Yes. I'm so happy to be here. And it's just so important to meet like-minded individuals that are also very passionate about the same messaging and education. And obviously it doesn't happen every day. So I was super excited to accept the invitation.
Yeah. And I'm so glad that it worked out for both of us, that I just happened, like the serendipitous nature of the fact that we're here together right now. I happen to have had some time in our schedule, and you happen to be available. So thank you so much.
Thank you.
So first of all, I wanted to ask, and again, we talked, and we're going to dive deeper into brain health, and I guess my first question for you is, why brain health? Why are you in the space of brain health?
Why brain health? So I've always really been fascinated by biology and life. And growing up, one of my first cousins, his name is Andre, um, has autism. He's near 50 now, and he was the first person that I ever was around and was able to observe on a personal level some of the challenges that not only he had with brain health, but also my aunt with taking care of him, especially as he grew older. Um, I think in general that we don't get enough education about how our bodies work. And the brain, for sure, we have really struggled with understanding how it functions, how to take care of it. So, Andre was definitely that first kind of window into my fascination with the brain, and especially when it's not working properly. And when I was in high school at Whitney Young, I was in the National Honor Society and I started to volunteer at a home on the south side of Chicago, Misericordia Home. And all of the residents there were living with profound intellectual disabilities. I became a rehabilitation aide, and it just something drew me to the fact that there's so much life in these individuals that I was caring for, but they couldn't talk to me. And just really being able to communicate with them in different ways, making sure they were comfortable. Most of them were living with G tubes and non ambulatory. So that was really my first real dive into brain health. And from there, I took off. But a lot of people, like a lot of people, I was met with the fear of the stigma. I can remember when I went to Dartmouth, I told my father, yeah, I took my first psychology class. I'm majoring in psychology. He said, that's a weak science. I would not do that if I were you.
He said it
And
was
so
a weak
a
science.
weak science. Yes, that
Yeah.
was the explanation. So we kind of left it there. And of course, I didn't come all the way to Dartmouth to major in a weak science. So I ended up pursuing a bachelor's in biology. But once I made it to my first med school rotation, third year, which was psychiatry inpatient at Bernard Mitchell at University of Chicago, I was sold again. I just said, well, this is what I want to do. Like the excitement with just rounding and being able to spend more time with individuals. Obviously, Western medicine can be so fast paced, and psychiatry was the one specialty where I was really able to listen to people's stories and understand more about them as a person and not just a bunch of labs. And so I went with it, and I have no regrets. But I will say, in the specialty of Western medicine, when it comes to different areas of concentration, psychiatrists don't get the respect that other specialties of medicine do.
So it's interesting that we're having this conversation and that we met, because I think that it's been maybe 3 years that I have a friend who did some work. She got a scan or something, and she's like, "Your brain." And I got a scan, and it told, shared, it provided this information. And it was really the first time that I'd ever heard anyone talk about our brain. And like everything is happening up there, up in here. And, but we look at everything but our brain. So I was fascinated with that, and it made so much sense. What is it about our brain? Why should we be paying attention to our brain?
So, first and foremost, we as human beings have major biological systems. I always start out with reminding everyone we have 10 major biological systems, if you really simplify it, and they are not separate. So, whether I'm talking about my gastrointestinal system, or my reproductive system, or my cardiovascular system, none of those systems are separate from our central nervous system, which is my favorite system, which is the system that houses all the electrical wiring and is so powerful. So when you think about the brain and how not only it impacts all those other systems, but vice versa, we're multisystemic. You can't take the brain and put it over here and keep it separate when it comes to that. picture of wellness. And if you go through the history of psychiatry and medical practice, there's a lot of reasons why that whole mind body separation occurred. Uh, but we have to reintegrate it. It's what was always fascinating to me is that in medicine, you've got three doctors that specialize in brain health. You have neurosurgeons, neurologists, and psychiatrists. And there's no specialty of medicine where if you present with the issue, we're not looking for some type of imaging tool to help us better diagnose and work up what the challenges may be. If we think about the functions of our brain, we put motor function, let's say, underneath neurology. If I lose blood flow to my motor strip, there's really no stigma with that. I don't say, well, pray about it. And I mean, we pray, we do,
Yeah.
but I'm not going to suggest that this is something within your self control or something that you willfully can um, impact. The motor system has lost blood flow, right? So it's injured. The point I'm making is when we look at the brain areas that have more control over mood, sleep wake cycle, emotion, those things, there's a whole different approach, right? A neurosurgeon is never going to operate on your brain without taking a picture first. But when it comes to psychiatry, if we're not talking about motor function or loss of sensation, or let's even say electrical misfiring in the case of someone being diagnosed with epilepsy, if now I didn't sleep for 5 days and I'm really excited, or what some people may refer to as having a manic episode, now we start to weave in other things: spirituality, ethics, moral, all those things. So it gets very complicated. And we've gotten away from using basic imaging and functional imaging and applying it also to what falls under that psychiatry area of specialty. So the types of images that most people are familiar with when it comes to the brain are structural images. You go to the ER, let's say you've had an accident or a stroke, we're going to put you in a CT scanner and we'll get information about structural issues, but it doesn't give us functional information. So when you think functional, think blood flow, think brain activity. We use functional imaging all the time in medicine for cardiovascular health and other organ systems, but we have not applied it to psychiatry, and that's a huge problem.
Let's talk about, you mentioned mood and emotions, and um, let's talk about the fact that there are so many people who are very highly functioning in the world, but who are also walking around emotionally unwell on the inside. And how does this work that you're doing, or are there any tips or any information that you can share with those folks? Because the thing is that because I don't remember any doctor ever saying to me, let's talk about your brain. Never. Right. And so I
Nope.
think that there's kind of the psychological aspect, or the talk therapy that many of us do, or, neurolinguistic programming to kind of, help. But what can a person who is highly functioning yet feeling emotionally distressed, what do you have for those folks, or how does this fit into the quality of life for those individuals?
Mhm. First approach is to take an integrated approach. So I mentioned 10 major biological systems. There are three systems that really hugely impact our emotional well being. If there is an underlying functional piece that we haven't properly worked up or diagnosed. So, starting with the gut, gut health is hugely important. We refer to the gut as the second brain. If you think about gut tissue, it kind of looks like brain tissue. And Everything that you put in there is going to have an impact on your brain. So I work with a lot of functional colleagues that specialize more in GI health. If a person comes to me highly successful, really struggling with emotional wellness, I do a full, thorough evaluation, starting with gut, next hormone. Our endocrine system is hugely intertwined with our central nervous system. We actually have hormone glands deeply seated in the brain. You can't separate the two. A lot of people who are high performing under a lot of stress, we can see that through different lab values with stress hormones, whether it be cortisol or DHEA. Those are telltale signs as to why a person may be experiencing exhaustion, burnout, just a lower level of tolerance, right, for all the things. When it comes to our hormone system, I also educate about ACEs. So anyone that comes to me is hugely important that they understand they didn't just pop up where they are right now in terms of their emotional well-being. We have to start at the beginning. I'm big on timeline. Where did you grow up? Who did you grow up with? What type of messaging did you hear?
Mm,
I'm big on identifying belief systems, or as I call it, your BS. All the things that you've downloaded that your parents or grandparents or cousins, uncles gave you, right? The brain is a big hard drive. So you just keep storing and storing and storing until next thing you know, that's your inner dialogue.
that's
So
right.
I do a lot of um, history gathering in terms of what stressors have you lived through, experienced from early childhood on through adolescence, young adulthood, and so on. Um, I would say the other system that oftentimes gets missed, especially in kind of our lifestyle in this society, would be immune system.
Mm-hmm.
There are lots of infections, pathogens, allergens, all the things that can trigger our immune system to be unhappy. And that can lead to inflammation in the brain, which can also present as low mood, sleep disturbance, brain fog. So, where we are with psychiatry is we diagnose a lot of symptoms. If you have depression, I'll diagnose you with major depressive disorder, right? It's 2025. You can go see a psychiatrist. You can report symptoms that are in a DSM 5, and you can leave with maybe 2 or 3 medications. No physical exam, no imaging, not even really a good history. And now you have several pharmaceuticals, not even any pharmacogenetic testing. We're all different genetically. So, how I respond to one medication may be totally different than you. And so, I would say those are my first steps, educating the individual on all the systems that impact where they are right now with their brain health. And helping them to understand, because some people, we're so far removed from integration and functional medicine. It's like, well, I just told you I was depressed. What is that? Why are you asking me what I ate last night?
Yeah.
Or why are you asking me how much sleep I got? Just really walking them through a mnemonic that we use at Amen Clinics called Bright Minds. You hit every letter in that mnemonic, you won't leave a stone unturned
Mm-hmm.
in terms of fully evaluating why a person may be struggling.
Yeah, I love the fact that you, because, obviously, and the work that I do, I love the fact that you dig into and help a person to dig into their history and in the ways that their history could be kind of running the show today.
Hmm. And
So,
increasing their risk for dis-ease.
yeah,
Hmm.
yeah. And so you've studied under Dr. Amen,
I
and
did.
yeah,
Hmm. I started working with him in 2022. That's when we
okay.
first met.
Oh, amazing. And I know that a lot of the work that he's doing is really reshaping psychiatry. Hey, it's Lisane. I created Protect Your Peace, a boundaries and accountability workshop, because I know what it's like to feel stretched too thin and how it feels when you're saying yes to everyone else, but feel like you're disappearing in the process. This workshop is your invitation to pause and to come back to you. In just 2 hours, you'll learn how to set boundaries that reflect your values, protect your energy, and strengthen your voice unapologetically. You'll also learn how to hold yourself accountable in a way that builds self-trust and momentum, not burnout. This is the kind of space I wish I had when I was deep in the cycle of over-responsibility and simply just doing too much. So I created it for you. Join me for Protect Your Peace, live or on demand, and walk away with tools you can use immediately to get back in alignment. Click the link in the show notes to register. You deserve to protect your peace and your power. So once you got into like brain imaging, what does that tell you about the communities that you're serving and some of the issues that are plaguing the communities that you're serving? So you opened up your world just, a few years ago to brain imaging. What has that taught you?
So during residency, we spent a lot of time with brain imaging. However, it is mostly applied to cases where you're following for neurosurgical purposes or neurology, whether it be MRI, CT scan. What Dr. Amen has done is taken those same tools, those same imaging tools that are readily used for other specialties of brain health, and now applying it to psychiatry. Psychiatry is the only specialty in Western medicine that doesn't look at the organ that they treat. So there's a big problem with that because people get misdiagnosed. You may misdiagnose someone based on going off of symptom clusters with a bipolar disorder, but they actually had a head injury as a child. Or you may diagnose someone with depression and ADHD when they actually have a smoldering infectious process going on from strep that they caught however many years ago, or Lyme disease. So what it has done is it has taken tools that we already have in the medical field, but allowed them to be used and applied when individuals present to a psychiatrist. What the game changer was for me was a young lady who was brought in about 15. Her mother brought her in for some behavioral changes, some concerns there, more isolating, appearing depressed. And after seeing her functional imaging, I was able to look at what we, through research, has found as indicative of trauma, known as the diamond pattern on a scan. We're able to see that fight or flight area, the basal ganglia, very highly activated. There's another system known as the cingulate gyrus and also limbic. She had a classic diamond pattern, but yet nobody is reporting any trauma. I explained to her parents it's hugely important for me to meet with her alone so that I can fully assess what else may be going on. After she knew that her scan supported trauma, she felt comfortable enough to report sexual abuse that was ongoing from a family member. She
Mm.
didn't want to talk about it because she was worried that she wouldn't be believed. For me, that was huge. I've worked with so many kids that are in the system, that are in the foster care system, that aren't able to speak their truth in certain situations. So many kids that have had head injuries in the homes that they've been removed from. It really gives me a picture if I'm meeting with someone, let's say at 15, 16, with behavioral disturbances, to look at their brain and see what information is given me, because you don't always have that history
Wow.
with adopted kids or kids that are, not in their biological home. The other big takeaways would be the work that I've been able to do with individuals that have traumatic brain injuries, whether it be professionals in the NFL, survivors of domestic violence. TBI is a major issue, even mild TBIs. We're seeing
What is TBI as an acronym for?
traumatic brain injury.
Okay.
A lot of people have mild traumatic brain injuries. They're not aware, or it's been minimized, right? Oh, yeah, I had a car accident 20 years ago. This got nothing to do with why I'm feeling anxious right now.
Mm-hmm.
It might, right? And so being able to see different brain systems, teach the neuroanatomy, help people understand if I damage my temporal lobes, that's the part of your brain behind the temples, which happens to be in a very vulnerable area, even if you have whiplash, that can present with anxiety. It can present with paranoia.
Mm.
There are structures there that are responsible for sensing danger in the environment. If they're not firing properly, you may sense danger that's not there.
Right.
So there's so many um, pieces of information that I am able to get with an image. And if you think about it, why wouldn't we image the brain just because we're talking about emotions and psychology? Like, it to me, it just makes no sense that we've like normalized that being okay. Why would you put a medicine and you haven't even seen the organ? So I
Right.
just think that we've really gotten away from some common sense.
Yeah. So here's what's brilliant about this to me, and that is that I would imagine, and I haven't done this yet, and I'll just say that full disclosure, right? So interested in doing it. And I will tell the audience that I actually am going to do a brain scan in the very near future. And I'll come back and talk about that a little bit once I do it. But what's brilliant about that to me is that it gives, like in the example of that young lady that you spoke about, it gives a person something to move toward. It gives information so that you can see kind of like it's the physical illustration of what a person may not have the capacity to be able to explain to you, is what I would imagine happened for that person.
100%. Because paralysis, we can see.
Yes.
Seizures, we
Yes.
can see, right? When it comes to, again, the motor sensory malfunction of the brain, we can see that. We can see cognitive deficits based on a person's behavior, intellect, what they are not able to do. But
Yeah.
when a person has to put into words how trauma is affecting their fight or flight system versus seeing it with imaging, that's a game changer. Also, you have people who are not sure. I mean, putting putting us all in this diagnostic manual is hugely limiting, and it does a huge disservice for a full functional approach to brain health and wellness. And I think it also adds to a lot of the stigma that people run from when it comes to psychiatry. We have to be real. Having certain diagnoses can impact professional options, right? Having certain diagnoses can potentially impact your own freedoms. And we've come a long way from a field where you could essentially be locked up indefinitely, shamed, your family shamed, all those things. We're still feeling all that. We're still the one specialty of medicine that can hospitalize someone involuntarily. So it doesn't always lend itself to the most comfortable exchange. A lot of times people approach psychiatrists with great hesitancy because while they want to speak on what it is that is going on with them, in the back of their mind, they're constantly thinking, is this the thing that I say that will then
That'll get me in trouble. Yeah.
exactly? Hmm.
I'm thinking about all the different people that I know, all the experiences, all the clients, right? And the ability to start at an assessment of really what's going on, not just what you can speak, but what's happening in your body physically. My mother was mentally ill, and I always felt that there was something, and for most of her life as an adult, struggling with mental illness, she tried to find ways to nourish herself or to find, foods or tonics or different things that would help to alleviate some of the symptoms of her mental illness. And even then, like, I was on that road with her because it's impossible that I think that we treat mental illness as if it just is. It just is what it is. And now we're going to move
And
forward.
it's permanent.
And it's
It's a
permanent.
chronic condition.
It's chronic. And this is just how you are going to experience this lifetime.
Right.
And it is such an epiphany to
Hmm.
hear from the medical community that focuses on the brain, that just the simplicity in, let's take a look at what's going on in there,
Correct.
right?
Correct.
Let's take a look
Yes.
at what's actually happening physically and treat it. And that's really the mind body connection. Like, that is the connection, but it
It
hasn't been
is
brought in enough.
at all.
Yeah.
Right? Like, just even think about how, because imaging is not considered a normal, established part of a psychiatric workup in a lot of cases, insurance doesn't pay for it, right?
Still,
Still, yes. And we're talking about types of images, right? So if I come into an ER and I have paralysis on one side, the first thing they're going to do is image my brain.
they're not going to talk to you until they've taken a look at what's happening physically in so many cases.
But if I come in suicidal, they're not going to do that,
Hmm.
right? So think about what's considered um, diagnostic criteria for paying for scans, for considering it medically indicated. There are lots of rules around that. There are also rules around paying for treatments. One of the best treatments for people that have had a head injury is hyperbaric oxygen. Well, the FDA pays for, or approves hyperbaric oxygen for certain conditions, but head injuries is not on that list.
How is that possible?
So there's a lot that we have to do in terms of the system with
Mm-hmm.
access, because you can still have all this great information, but when it comes to our communities and really getting it to the underserved and making it affordable, that is a whole another challenge, right? Dr. Amen, myself, and other doctors are taking part in this brain health initiative with the faith committee um, at the White House, where there's a lot of attention being drawn to the entire system being broken, getting away from even using terms like mental illness because it's so stigmatizing,
Yeah.
but normalizing brain healthy conversations. I'm
Yeah.
talking about my brain. I can give you another example. Some people who have OCD, obsessive compulsive disorder, where there's a lot of checking and repetitive compulsive thinking, most people don't know that that can be caused by a bacteria,
Mm.
right? And that a lot of children who present with a sudden onset of OCD symptoms have recently had a strep infection, and that there are certain antioxidants and supplements that you can give instead of giving them Prozac, right, to help with those symptoms, and antibiotics, right? So until we understand that we shouldn't be diagnosing people based on their symptoms, we'll continue to have people walking around with underlying health conditions that have not been properly worked up and medicated with pharmaceuticals that unfortunately can lead to long term negative outcomes. My cousin Andre now lives with tardive dyskinesia because he was given a certain class of medication that we refer to as neuroleptics. He was given that class of medication for years, And it long term can cause the brain to present like someone with Parkinson's.
Mm,
So they refer to that as tardive dyskinesia. It's a uncontrolled movement because of the mechanism of the medication over many decades. A lot of people are living with that, some of whom weren't even told in some cases that it was a risk. So,
yeah. We talk on this podcast, and all of the work that I do is around generational healing. And through the lens, your lens, as a psychiatrist, what role does brain health play in um, legacy health?
huge. Starting with conversations, starting with just even being able to talk about cognitive functioning and brain health. Going back to what I told you about my father's comment, my father is a Vietnam War veteran, experienced a lot of trauma, survived malaria, grew up in Wentworth Gardens on the south side of Chicago. His father was from Kingston, Jamaica. My grandmother really struggled financially. There was a lot of trauma, but for many generations, you don't talk about that. You don't talk about things that may lead to you being perceived as weak, lesser than, not capable. There are lots of experiences when it comes to generational healing that I'm going to say baby boomers, they're not going to talk about. Like, that's not how they were raised. They were raised, hear no evil, see no evil, speak no evil. What goes on in his house stays in his house. And for a lot of that, it was for protection, right? And so I think that generational healing is so important. It's so hard for one or two people in a family dynamic to want to free themselves from the shackles of trauma and all the things, and then have a multitude of other family members that see them as messy or bringing up stuff that we don't want to talk about. It's such a delicate dance. And so I am just like you in that regard. I believe that healing has to start with a lot of that generational trauma that in some families have been there for many, many generations. And being able to not approach it from a shameful place, but a place of being motivated to heal, to come out on the other side with new information, knowledge, and empowerment instead of continuing to pass on negative um, negative brain health outcomes is how I'll say it. I don't know if you're familiar with the ACEs study, but adverse childhood experiences survey. I would encourage anyone in your audience to go through that survey and understand that there is a disease connection to experiencing early childhood adverse events, whether it be in your home, outside the home. It is hugely important for you to not only take inventory, but to do all the things that will help you reset your health, even if generationally being stressed out, being in fight or flight is normalized, and suppressing and not talking, right? Helping people to just live in their truth and not have to deny what it is about them that maybe is not accepted in their family or accepted in certain spaces that makes you sick. Okay. And so I think that piece is really, really important for the audience to understand. We start off very early on impacting the health of our children, our teenagers, our young adults by the messages that we give them, everything that they're watching, everything that we're saying, modeling, all the things. This is the hard drive. It's being downloaded and it's hard to delete files once they're in there. So um, I try to help people as much as I can delete and download new information
Make some space in there. No, I want to stay here for a second because I think what needs to be normalized is to be able to talk about even what's not seen. I think we're taught and programmed to appear normal, to appear functioning, to function higher. And when we feel some struggle with that, to just do better, get more organized, get more focused, work harder, and we treat ourselves and as a result, um, other people like robots.
Yep.
And I think that the more, this is information that has to get out there. All right, can we talk a moment about setting the vibe? If you're anything like me, your space needs to feel good in order for you to feel good. And that's why I created the Shaping Freedom line of candles. It's not just about ambiance, but really about how you align yourself internally. These are more than just candles. They shift your energy. Whether you're journaling, meditating, working out, or just taking a moment for yourself, these scents are curated to ground you, lift you up, and bring you back home to yourself. They also have an 80-hour burn time and scents that are designed to evoke feelings of alignment and internal congruency. And we can all use that. Go to shop.shapingfreedom.com and check them out. Find the one that speaks to your spirit, or buy all four, and let them burn with intention. These are the kind of conversations that we need to have at the table, because if someone were to come to the table and, excuse the grossness of this, but throw up on the table, we'd address that.
Correct.
Because something happened that we all see.
It's tangible.
It's tangible, exactly.
That's what it is. But that's the difference.
Yeah. The person who's sitting at the table struggling to function, struggling to show up and appear normal, and I'm putting that in air quotes, we don't see that. And until more and more parents, and I'm closer to baby boomer than I am to millennial, and I know there's a generation in there that I'm missing, but I was raised like, you pull yourself up by your bootstraps, and I'm the daughter of a Haitian father and a Puerto Rican mother. So you pull yourself up by your bootstraps. It's all about making it happen. And there was, no disrespect to my parents at all, but there was no room to talk about the things that seemed imperfect.
Correct.
Right. And it was all, and it was all with the best of intention, right? Like, don't let that get you down. Just get up and go. You'll be fine. Like, get dressed and get up and take a shower. You're fine. It's fine. It's okay. And when I think about my own life as a young person living through my parents being divorced, and, I'm going through like a series of things that happened in my own life that I know are very similar to the experiences that so many people experience. What happens is that behavior gets passed along to me. Then I take it and I pass it along to my unchecked. If it goes unchecked, if I don't stop to say, wait a minute, I'm hurting. This situation happened. How is it impacting me? And now with this added, so simple, but formerly so hidden, this added piece of the puzzle, where it's like how I'm feeling and how the symptoms that are coming out emotionally and mentally, but also what's happening in my body.
Yes.
For us to normalize those conversations and educate parents and grandparents with what this means, and how focusing on brain health can help the people that they love.
Absolutely.
We need to be having those conversations more.
Yes. Relational, emotional intelligence starts with brain health. If you get the brain right, your mind will follow.
Yeah.
Right.
Yeah.
So we're talking about raising brain healthy children. I think it's baby boomer, Gen X.
I may be Gen X.
Gen
I'm not
X. I
Gen
think I
X.
think yeah, a millennial then Gen Z. Yes.
Okay, I don't
I'm
know.
the earliest millennial, 81.
Okay, there you go.
But yeah, but the baby boom, I mean, like I mean, I see it in my own family. I see it obviously every day in the professional space where just even that theme of perfectionism, and I tell people perfectionism is not an attainable goal. You're going to be disappointed every time. And
Yeah,
where is the balance with setting that bar,
yeah,
wanting to achieve, but also making sure that you take care of you unapologetically? We literally live in a society where you can really, really neglect yourself and get all the accolades, right?
yes, and be encouraged to neglect yourself.
You're a hard worker, you push through,
Yeah,
you're resilient, right? All those things. But we need to step away from when a person needs support, help, and a space for them to keep it 100 without us labeling that as weakness or breakdown. I tell people all the time, where do you think the term she had a nervous breakdown came from? That's menopause.
mhm.
Like, why are all these women
That's
in the
menopause while there are a bunch of other things happening on top of it. It's too
correct?
much to
And you
hold.
lost all your estrogen, ma'am.
Wow.
Like,
Yeah.
please be nice to yourself. Be gentle with yourself. It's hard out here without estrogen,
Yeah. Yeah.
okay?
Yeah.
Especially those years where our brain is literally adjusting to the decrease and the fluctuations of those hormones. But I mean, being in the space that I'm in, I get to see firsthand how hormones affect women when it's really, really a negative impact. But even on the milder side of that spectrum, you have women every day in that chapter of life, and we're still expected to show up and show out.
That's right.
What are we doing to support those biological changes?
That's right.
Um, or, instead of just shaming.
Yeah. In my friend circle, they know. But I will in a minute say, I'm sorry, I'm not coming. Girl, what do you mean? No, I'm not. Well, what are you going to do? I'm going to take a nap. Girl, you can sleep when you're dead. I'm like,
Yes,
yeah, maybe, but
I'm going to go lay down.
I need a day. I need
Yes.
a day.
That's another one that's huge too, especially in the high achieving spaces, lack of sleep. When you're sleeping, people, we look at sleep as just this waste of time, the whole I'll sleep when I'm dead. Okay, when people say that to me, I say, well, you might get there a lot sooner than you want to. Okay, because when you sleep, your brain takes out the garbage. Your brain is firing all day long, all these chemical reactions and doing things just like that. I mean, you don't have to think about half of the autonomic stuff that your brain is doing. You don't think it needs to be plugged in just like your cell phone.
Mm.
That's when you plug it in, when you recharge your battery. That's what sleep is. Anybody that I sleep deprived for 5 days, 10 days, what do you think they're going to look like if I duct tape their eyelids open and put them in a closet and go back in there? They're going to be seasoned,
Mm-hmm.
psychotic, manic, possibly all the things. It's going to be a big ball of electricity that's misfiring. So that one I want to say for sure, we really, really focus in on sleep hygiene, quality of sleep. I can't tell you how many scans I've done where it looks like inflammation, low blood flow. The person's like, I don't know. I think I have ADHD. No, you have sleep apnea. Okay, so it's you have to take in all of the systems to really accurately diagnose. So many people want to be at the top of their game, which I 100% respect, but there are lots of natural things that we can do other than saying, okay, well, now I must have this executive functioning disorder and let me take X, Y, and Z. It's kind of the band-aid.
Right.
So
And the thing is, and the thing that I am acutely aware of, and I know you are as well, is with all those things you just described in the person who's sleep deprived and low oxygen to the brain and all of that, those are the people that are raising their children in relationships with other people. They're your colleagues, they're the people that you're managing and the people that are being managed, the people that are managing you. And this is why this is so important. And I think that because this world, society teaches us, and it's not true and it's incorrect, that you just get out there and go in the world and do the thing. And as long as you're not bleeding out or
Right.
falling out, or as long as your body has not sent you to bed, which our bodies can do when we've pushed it too far. I know it's happened to me on more than one occasion, right? We think that we're okay. But this is a quality of life discussion. This is what we can do to more positively impact not just ourselves, but positively impact our ability to contribute to our familial legacy. It is important.
Very important.
So let's talk about how, for the person who's listening. And I think that by now in this conversation we have talked about all the reasons you need to be sitting down, ears open, ready to hear this next part. Okay, understanding how important it is to focus on this on brain health. How does a parent help their child or their children to better understand brain health, and what can a person do for themselves?
hmm Starting with health literacy, starting with educating on purpose yourself about how your body works. It's crucial. Starting very young, having open conversations about body functions, how to take care of the body, right? It's not just a passenger in the seat of life that's just along for the ride. We want to be intentional about what we're doing to take care of ourselves. So I would start very young with having those conversations with your children and making it fun, making it interactive, normalizing it. I'm big on report cards in families. We get
Mm.
graded at school. Let's get some grades at home.
Let's have a personal development plan at home.
Correct,
Mm-hmm.
right? I believe that parents should make a space where their kids can respectfully give them feedback, not be I'm your parent, you do as I say, go sit down and be quiet, but respectfully, we're going to have a conversation. What are some things that you may need from me? What is it that you'd like to see me do more of or less of? In child therapy sessions with parents, those are questions that I kind of start out with. What are we working on? Where are we getting great grades? Where is there room for improvement? And just normalizing the conversation. So many people are just scared to give feedback to individuals because let's just be real, a lot of people are not receptive when it comes to saying, this is what I think you need to work on.
But at home, it's the job of the parent to create a safe space
Absolutely.
for children to be able to share what makes sense, even what doesn't make sense. That is part of our job. Our role
And ask questions.
is to ask questions, to talk a little bit less, ask more questions, and ensure that you're creating a safe space where your child can come and tell you what's going on so that you can truly help them.
Correct. How we receive that, how we support it and facilitate it is huge. Keep the ACEs top of mind as you're parenting. Am I doing any of these things? Am I in any way creating a toxic, traumatic environment for my child? We all know that doesn't have to be physical abuse or maltreatment.
We don't all know that, Napatia. We don't all know that. That's part of the problem.
Let me be clear that a lot of abuse is not because of the laying of hands or objects.
That's right.
A lot of abuse is neglect, okay? Being checked out. I don't have time to talk to you because I've got all this stuff I need to do after my work day. And just, you may have all the best intentions, but how that's received by the child is what's important. Also, consider just not seeing what the child wants to bring to you as important, kind of just shooing it away, or like, oh, like you said, you're
You're
fine.
fine.
All you need to do is blah, blah, blah. So I would say having those conversations intentionally, I encourage parents who I work with to put it on the calendar. We're going to have our 30-minute meeting where you get an opportunity to tell me how I'm showing up, vice versa. That way, every time we have these conversations or I'm giving my child feedback, it's not just when something is wrong. The balance with that is huge because a lot of kids only hear from their parents when it's something that they want them to address, that they see as wrong. So you'll get kids that say, like, well, yeah, all my mom or all my dad cares about is if I have the best grades or if I'm in this organization, but they don't feel loved outside of that. It's a performance based love. Okay. If you do X, Y, and Z, then I will show you how much I care. We need to tell our kids that regardless of what it is that they're seeking to achieve. I think the teaching kids very early on how to take care of their brain. We have a program called Brain Thrive to 25 that I use with a lot of students whom I work with. I also live here in Parkland where unfortunately there was a mass shooting, and I've taken the time to go into those schools, talk to students about all the things that help grow a beautiful, healthy brain. Again, unapologetically. What are those ingredients,
Mm-hmm.
right? How much screen time, how much sleep, how much fiber, how many omega 3s, like having all those conversations and not making it separate from how you feel. All those things impact how you feel, how you show up, how you focus on any given day. But the emotional intelligence, I think, is key with kind of where we're coming from as a collective, being able to be there for your kids and create a space to talk about emotions, to talk about feelings, talk about relationships with other students and teachers. It is very important because they're learning right now in real time, just like they learn how to ride a bike, how to relate to people once they step outside that house. And they're modeling what you're doing. They are downloading a lot of information consciously, unconsciously, and they're going to show up in the world as a product of all of those ingredients. So I think that parents need to feel a little more empowered. I
Mm-hmm.
think that everybody talks about work life balance. We know for us high achievers who are also parents, easier said than done, right?
And it's harmony. It's not balance. It's never going to be balance. It's never going to be 50-50. It's just not how it is.
There you go.
Yeah.
And but making sure that that lesson is taught, that your child's emotional well-being, physical well-being is just as important as their grades and how they're achieving in school. That message is really lost in a lot of families across many different cultural groups. To be honest with you, it's. I think it's more of our priorities that we have in our society.
Right. And if we're sitting, and I know we're coming short on time. Um, if you're sitting and if your defensiveness leads you to say things like, well, I feed them, I clothe them, I send them to school, I send them to soccer, I blah, 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 a list of things that you do, that's indicative of you looking at the wrong thing. Because those are, yes, you're doing
There are
that.
some
Yes.
parents that truly feel. I kid you not, and it's so funny you would say that. Maybe about 4 months ago, had a similar conversation with a relative
Mm-hmm.
because we were trying to speak on the dynamic between that individual and their adult child, and they listed that same list.
Yes.
I did this. I put a roof over your head. I made sure I went to work every day. I made sure you had clothes on your back. I made sure you had food in your. And the conversation was, do you think that your child felt loved by you? And that was the list to say, well, they better. Because I did all these things, so I know they got to feel loved. And if they don't, it sounds like a them problem.
But we need to make it make sense, because here's the thing. In a relationship, and I'm not going to go too deep into it because you and I can dive into this conversation for 5 hours. I can feel it, right? I can feel it coming.
Correct.
But in a relationship, if you were in a relationship with someone and you said to that person, I do not feel cared for, and that
Mm-hmm.
person said to you, what are you talking about? I took out the garbage last week. I brought you the newspaper. I'm dating myself. I bought you roses and gave you a list. I took you out to dinner and gave you a list of
Right.
things that they did for
Right.
you. what that does is it translates into a relationship that's based on what that person has taken from themselves. And we cannot approach our parenting in that way, because our role as parents, the basics are to make sure that your children eat and, are fed and clothed and
That's
housed. And
survival mode
that's
parent.
survival mode. Exactly. That is survival mode
But
parenting.
we've normalized it to make it good parenting. If I
Absolutely.
did all that, you should be
Absolutely.
giving me 5
Mm-mm.
stars.
Mm-mm. Yeah,
Yeah.
and you get the stars for that. But just
Hmm.
like any other report or report card, right? There are sections. So you get an
Correct.
A for that.
Correct.
Bravo.
Necessities.
Necessity. Now let's
Right.
move on to the other things, right? How have you taught this person to be in relationship with themselves? Right? How have you contributed to the quality of the relationship that that person is in with themselves?
Hmm.
Because that's who that person has to walk through the rest of their lives interacting with.
It's the first relationship we have.
Yeah, yeah. And then they wind up going to Dr. Napatia T. Gettings, and she has to work with them to undo some of that
Hmm.
nonsense, right? So I'm not
Yes.
trying to take you out of your work,
No,
but
100%.
we need to really pay attention to this. We need to really pay attention to the importance of the quality of the relationships that we're having and the quality of the
Yes.
spaces that we're creating in our homes, and help our children and the people who we love and the people who are around us to focus on the right things.
Like their life depended on it,
That's right.
because it actually does. Hmm.
That's right.
Yeah.
So, how can we tell us really quick, like, what do you do? What does it look like? How can people interact? How can people come to you to get some help and support?
Yeah. So I'm Florida based. I work with clients all over the US and some internationally. All of my services are telehealth, but we have 11 clinics nationwide for brain imaging. So I work with clients wherever you are locally. We can arrange for not only a functional imaging, but also functional assessment. My handle on all social media is at Dr. Gettings, Dr. Gettings. My website is drgettings.com. It is currently being revamped and rebuilt. Health library coming, and I'm starting an entire new venture known as Clarion Neuro, where I'll be integrating lots of technology that will allow not only the interface with accessing records, but also imaging labs, all the things. So to find me, it's not hard, drgettings.com. I'm really building out my YouTube channel, putting a lot of content on there. So for those of you YouTubers, please go watch, subscribe. Yeah, Dr. Gettings.
We'll put all that information into the show notes. And Dr. Gettings, one last question. How can we support you? How can we support this incredible work that you're doing?
I would say the best way to support me is have more conversations about brain health just on a daily basis. I know we create these types of platforms in order to really educate and take deep dives and go over all the things, but I think just committing to intentionally talking about brain health and mental wellness does a lot, because so many people aren't comfortable having those conversations, and just a little bit of normalizing education and safe spaces goes a long way. Um, Making sure that they know that I'm out there, that I'm a resource, and that I work with a great team of doctors that are really dedicated to changing this mental illness construct that we have, and transitioning it to a wonderful brain health initiative where we can all unapologetically talk about our brains.
And how, I know you said that you mentioned that your website is, you're working on revamping it. How can a person who's listening, who knows that they need to reach out to you, how can they do that?
Info at drgettings.com.
Okay.
That email right there will get you to my team. And any questions that you have, just send them to info at drgettings.com.
Thank you so much I know how busy you are.
You're welcome. Thank you so much for having me.
I appreciate you spending this hour with me. I really do. And thank you so much for shedding light on something that is so important, critical to the quality of the familial legacy that we pass along, and also to the quality of life that we have. I mean, imagine
Yes.
being able to find a way to actually address some of these hidden discomforts that so many of us live with. So thank you so much for that and for the work that you're doing.
I look forward to working with you and many others. So I see this as the beginning.
That was such a great conversation. I enjoyed it so much. Connecting with Dr. Gettings was such a blessing for all of us. I love learning, and I am fascinated that I'm getting to learn so much about brain health. And I guess it's better late than never. I encourage you that if something about this episode resonated for you, please like and share the episode with other people. And if there's something in this episode that touched you, if there's something that you need to do differently to better impact the environments that you live within, please go ahead and do that. The more we're willing to take small steps toward healthier living, mental, emotional, physical, spiritual, the better we all are. Sometimes we focus so much on what's happening out there, and I'm here to encourage you to focus your attention on the place where you truly have the most agency, and that's within yourself. Your family will thank you for it. The people you're in relationship will thank you for it. And I want to deeply thank Dr. Napatia Gettings for taking the time to share her incredible knowledge and experience with us. So until next time, this is Lisane Basquiat with the Shaping Freedom podcast. Be well.